Why many seniors are turning to this vitamin for joint pain and weak legs ***. If you are over 50 and wake up every morning with stiff knees, aching hips, or legs that feel weak and unstable, this message is for you. Millions of seniors reach for painkillers every day, hoping for relief. But relief often comes with a price: stomach issues, dependency, and long-term side effects. What if the real problem isn't just pain, but what your body is missing? Vitamin D deficiency is one of the most overlooked yet significant contributors to joint pain and weak legs, especially among seniors. As we age, our body's ability to produce and absorb certain nutrients naturally declines, and vitamin D is no exception. This vitamin is unique because it acts more like a hormone in the body, regulating numerous processes that are essential for maintaining bone and muscle health. Without adequate vitamin D, the body struggles to absorb calcium effectively, which is critical for keeping bones strong and resilient. When calcium absorption is insufficient, bones gradually become weaker and more prone to conditions such as osteoporosis, which is a leading cause of fractures in older adults. This weakening of bones often manifests as joint pain because the skeletal structure can no longer support the body as efficiently as it once did. Additionally, low levels of vitamin D are directly linked to muscle weakness. Muscles require this vitamin to function optimally, and a deficiency can lead to diminished muscle strength, slower reflexes, and poor balance. For seniors, these physical changes are particularly concerning because they increase the risk of falls, which can result in serious injuries, hospitalizations, and a significant decline in overall quality of life. The symptoms of vitamin D deficiency often start subtly, making it easy to ignore. Many seniors assume that stiffness in the knees, hips, or lower back is just a natural part of aging, when in fact it may be a clear sign that their body is lacking this critical nutrient. Pain may come and go, sometimes worsening after periods of inactivity, which can further reinforce the misconception that nothing can be done. In reality, addressing vitamin D deficiency can lead to noticeable improvements in joint comfort and leg strength over time. Beyond its role in calcium absorption and muscle function, vitamin D also has anti-inflammatory properties that help reduce chronic inflammation in the joints. Chronic inflammation can exacerbate pain, swelling, and stiffness, creating a cycle that makes movement increasingly difficult. Seniors who supplement appropriately or increase their vitamin D intake through diet and safe sun exposure often report reduced joint soreness and improved mobility. Another important aspect of vitamin D is its effect on neurological function. This vitamin plays a part in maintaining nerve health, and insufficient levels may impair nerve signaling that controls muscle movement and coordination. This impairment can contribute to a feeling of weakness in the legs, a wobbly gait, and decreased confidence when walking. Many seniors may not connect these issues to a simple vitamin deficiency, attributing them instead to general aging, but scientific studies consistently show a correlation between low vitamin D and reduced muscle strength, particularly in the lower limbs. Furthermore, research indicates that vitamin D deficiency is surprisingly common among older adults, even in regions with ample sunlight. Factors such as spending more time indoors, limited sun exposure, darker skin, certain medications, and medical conditions that affect nutrient absorption can all reduce vitamin D levels. Blood tests can measure this deficiency accurately, yet it is often underdiagnosed because the symptoms are vague and gradual. Addressing vitamin D deficiency is not merely about taking supplements, it is about restoring the body's natural ability to function efficiently. Once adequate levels are achieved, the body can better maintain bone density, support muscle function, and reduce inflammation, all of which directly impact joint health and leg strength. This means seniors may experience less pain when walking, climbing stairs, or performing daily activities, and they may regain confidence in their physical abilities. It also highlights the importance of proactive health management, as waiting until pain becomes severe often results in slower recovery and more limited options for improvement. Regular monitoring of vitamin D levels, combined with dietary and lifestyle adjustments, allows seniors to address deficiencies early and take control of their musculoskeletal health. Recognizing the link between vitamin D deficiency and joint pain is a critical step in understanding why many older adults experience chronic discomfort and mobility issues, and it underscores the potential for a simple, targeted approach to improve overall quality of life. Painkillers are often the first solution that comes to mind when seniors experience joint pain or weakness in their legs, but while they may offer temporary relief, they do not address the underlying causes of these issues. Painkillers work primarily by blocking the body's perception of pain. They interfere with chemical signals in the nervous system so that the brain does not register the discomfort, which can create a sense of relief almost immediately after taking the medication. However, this relief is purely symptomatic. Painkillers do nothing to strengthen bones, improve muscle function, or reduce the inflammation that is often at the root of chronic joint pain. This distinction is crucial because masking pain without addressing its source can sometimes lead to further injury. When seniors rely heavily on painkillers, they may continue to engage in physical activity without realizing that their joints or muscles are weakened, increasing the risk of strains, falls, or other injuries. Over time, this reliance can create a cycle in which the medication dulls the discomfort temporarily, but the structural problems in bones, cartilage, and muscles continue to worsen. Long-term use of common painkillers, including over-the-counter options like ibuprofen or acetaminophen, also carries significant risks. Chronic use can lead to gastrointestinal issues, including ulcers and bleeding, as well as kidney and liver strain. These potential side effects are particularly concerning for older adults, who may already have diminished organ function or other medical conditions that make them more vulnerable. Moreover, painkillers do not stimulate the body's natural repair mechanisms. The joints, cartilage, and muscles require proper nutrients, exercise, and care to maintain strength and flexibility. Painkillers do not provide any of these benefits. They only provide a temporary perception of comfort, which may give a false sense of well-being. This false sense of relief can sometimes prevent seniors from seeking more effective, long-term solutions for joint health. For example, a senior who feels less pain due to medication may postpone physical therapy, targeted exercises, or nutritional interventions that could actually improve muscle tone, support bone density, and reduce joint stress over time. Another factor to consider is that painkillers do not address inflammation at its source. Chronic inflammation in the joints is a major contributor to discomfort, stiffness, and reduced mobility, yet most painkillers only block the sensation of pain rather than reducing the inflammatory process itself. Anti-inflammatory drugs can help somewhat, but they still do not strengthen muscles or repair damaged cartilage. In contrast, interventions that target inflammation directly, such as proper nutrition, vitamin supplementation, and regular movement, can support the body's ability to heal and maintain joint function. Relying solely on painkillers can also affect mental health and quality of life. Living in constant pain may cause anxiety, depression, or a sense of helplessness, yet temporary relief from medication does not provide the confidence and freedom that come from genuinely improving mobility and strength. Seniors may find themselves cycling between pain, medication, and inactivity, which can accelerate physical decline and reduce independence. Painkillers can be useful for occasional flare-ups or acute discomfort, but they are not a long-term solution for the systemic issues that lead to joint pain and weak legs. True improvement requires interventions that strengthen the musculoskeletal system, support bone health, and enhance muscle function. By focusing only on masking symptoms, seniors miss the opportunity to address the root causes, leaving them at risk for worsening pain, decreased mobility, and the complications associated with chronic medication use. Understanding this distinction is critical for anyone seeking sustainable relief, because it highlights why a strategy based solely on painkillers is inadequate and why a more holistic approach is necessary to maintain joint health and overall mobility over time. Improving vitamin D levels can have a profound impact on the overall health and function of bones, muscles, and mobility, particularly for seniors who are experiencing joint pain and weakness in their legs. Vitamin D is essential for the body's ability to absorb calcium from the diet, and calcium is one of the primary minerals responsible for building and maintaining strong bones. When calcium absorption is impaired due to insufficient vitamin D, bones gradually become weaker and more brittle, which increases the risk of fractures, osteoporosis, and chronic pain. By ensuring adequate vitamin D intake, seniors can support their skeletal structure, providing a stronger foundation for the joints and muscles that carry them through daily activities. Beyond its role in bone health, vitamin D plays a crucial part in muscle function. Muscles rely on this vitamin for proper contraction, strength, and coordination, and a deficiency can lead to weakness, poor balance, and slower reflexes. For seniors, this weakness often manifests as difficulty rising from a chair, climbing stairs, or walking for extended periods, and it contributes to a higher likelihood of falls and related injuries. When vitamin D levels are improved, muscles become more responsive and stronger, which directly translates into better mobility and greater confidence in performing everyday tasks. Adequate vitamin D also has anti-inflammatory effects, which can further enhance joint health. Chronic inflammation in the joints is a common contributor to stiffness, pain, and reduced range of motion, and it can make even simple movements uncomfortable. By increasing vitamin D intake, seniors may experience a reduction in inflammation, leading to less pain, more flexibility, and smoother movement. This improvement in joint comfort not only helps with physical activity, but also encourages seniors to remain active, which in turn strengthens muscles, supports bone density, and enhances cardiovascular health. Mobility is another area where vitamin D makes a measurable difference. Studies have shown that seniors with sufficient vitamin D levels tend to walk faster, have better balance, and perform physical activities with more ease compared to those who are deficient. These improvements in mobility are critical because they allow seniors to maintain independence, participate in social activities, and sustain a higher quality of life. Even small gains in muscle strength and joint flexibility can make a significant difference in day-to-day functioning, reducing the fear of falls and increasing overall confidence. Another key benefit of improving vitamin D levels is the support it provides to the nervous system. This vitamin plays a role in maintaining nerve health and efficient communication between nerves and muscles. When vitamin D is low, nerve signaling can be impaired, contributing to slower reflexes and a sensation of weakness or imbalance in the legs. By correcting this deficiency, seniors can improve coordination and stability, which directly impacts their ability to move safely and comfortably. Addressing vitamin D deficiency is often straightforward through a combination of safe sun exposure, diet, and supplementation if needed. Foods such as fatty fish, fortified dairy products, and eggs provide natural sources of vitamin D, while supplements can help fill gaps that cannot be met through diet alone. Regular monitoring of vitamin D levels ensures that seniors achieve and maintain optimal levels, avoiding both deficiency and excessive intake. When vitamin D levels are supported consistently, seniors often notice gradual improvements in joint comfort, leg strength, and overall mobility. They may find it easier to engage in exercise, enjoy outdoor activities, and carry out daily tasks without discomfort. This kind of internal support is far more sustainable than temporary pain relief from medications because it strengthens the body rather than simply masking symptoms. Over time, maintaining adequate vitamin D levels can lead to a more active lifestyle, better posture, and enhanced resilience, helping seniors remain independent and confident as they age. By focusing on improving this critical nutrient, seniors are addressing a root cause of joint pain and weakness, allowing the body to function more efficiently and naturally. Seniors over the age of 60 face unique challenges when it comes to maintaining joint health and leg strength, largely because the body undergoes significant physiological changes that affect bones, muscles, and overall mobility. One of the most important factors contributing to these challenges is the decline in nutrient absorption that naturally occurs with age. As the body ages, the skin becomes less efficient at synthesizing vitamin D from sunlight, the digestive system may become less effective at absorbing key vitamins and minerals, and the kidneys may process nutrients differently, all of which can lead to deficiencies that impact musculoskeletal health. Calcium and vitamin D, in particular, are critical for maintaining bone density and strength. When levels of these nutrients drop, bones become more fragile, joints may experience increased stress, and the risk of fractures rises substantially. Muscle mass and strength also decline with age, a process known as sarcopenia, which is compounded by decreased activity levels, hormonal changes, and nutritional deficits. Weak muscles around the joints reduce stability and mobility, making everyday tasks such as standing from a chair, walking, or climbing stairs more difficult and potentially hazardous. This weakening of the musculoskeletal system often manifests as stiffness, pain, and a sense of imbalance in the legs. Seniors may notice that their movements are slower, that their legs fatigue more quickly, or that minor exertion causes discomfort. These changes can lead to a reduced quality of life, decreased independence, and a higher likelihood of falls, which are a major cause of injury and hospitalization among older adults. The aging process also affects cartilage, the flexible tissue that cushions the joints. Over time, cartilage may become thinner and less resilient, leading to friction in the joints and the development of conditions such as osteoarthritis. Combined with weaker muscles and declining bone density, this can make simple movements painful and reduce overall mobility. Hormonal changes, particularly declines in estrogen and testosterone, further contribute to bone and muscle loss. These hormones play a role in maintaining bone density and muscle mass, and their reduction with age accelerates the deterioration of musculoskeletal health. Another challenge for seniors over 60 is decreased blood flow and circulation, which can limit the delivery of nutrients and oxygen to muscles and joints, slowing repair processes and recovery from minor injuries or overuse. In addition, chronic inflammation tends to increase with age, which can exacerbate joint pain, stiffness, and swelling. Lifestyle factors, such as decreased physical activity, poor diet, and limited sun exposure, can compound these physiological changes. Sedentary behavior accelerates muscle loss and joint stiffness, while inadequate nutrition limits the body's ability to repair and strengthen musculoskeletal tissues. Addressing these age-related changes requires a comprehensive approach that includes proper nutrition, targeted exercise, and attention to nutrient levels, particularly vitamin D and calcium. Ensuring adequate intake of these nutrients supports bone density, muscle strength, and joint health, helping to offset some of the natural decline that occurs with aging. Exercise is equally important, as it stimulates muscle growth, improves balance, and enhances circulation, all of which contribute to stronger legs and more stable joints. Simple activities such as walking, resistance training, and balance exercises can have a profound impact on mobility and independence. In addition, maintaining optimal body weight reduces the stress on joints, particularly in the hips, knees, and lower back, further preserving joint function. Regular medical checkups, including monitoring of bone density and nutrient levels, allow seniors to identify deficiencies or weaknesses early and take proactive steps to address them. Early intervention is crucial because the longer musculoskeletal decline progresses unchecked, the more difficult it becomes to reverse or mitigate. By understanding the unique risks that come with aging and taking steps to support bones, muscles, and joints, seniors over 60 can maintain greater mobility, reduce pain, and enjoy a higher level of independence in their daily lives. Consulting a healthcare professional before beginning any supplementation is absolutely essential, especially for seniors who may already be managing multiple health conditions or taking prescription medications. While nutrients like vitamin D, calcium, and other vitamins and minerals can provide significant support for bones, muscles, and joints, their effects and safety can vary depending on individual health circumstances. A healthcare professional can evaluate personal medical history, current medications, and lifestyle factors to determine the appropriate dosage and form of supplementation. Without this guidance, there is a risk of taking either too little, which may be ineffective, or too much, which can lead to toxicity or interfere with other treatments. Seniors often have unique considerations, such as reduced kidney or liver function, that affect how the body processes supplements. Certain vitamins and minerals, when taken in excessive amounts, can accumulate in the body and cause adverse effects. For example, Too much vitamin D can lead to elevated calcium levels, which may cause kidney stones, heart rhythm disturbances, or other complications. A healthcare provider can recommend safe levels and monitor blood tests to ensure supplementation is both effective and safe. Another important reason to consult a professional is that joint pain and leg weakness can have multiple underlying causes. While nutrient deficiencies are common, they are not the only factors contributing to discomfort. Conditions such as arthritis, neuropathy, circulation issues, or hormonal imbalances may also be involved, and addressing these issues often requires a tailored approach that supplements alone cannot provide. A healthcare provider can help distinguish between different causes and develop a comprehensive plan that may include exercise, physical therapy, lifestyle adjustments, and targeted supplementation. Additionally, a professional can recommend the best forms of vitamins and minerals for absorption and effectiveness. Not all supplements are created equal, and some forms are more bioavailable than others, meaning the body can absorb and use them more efficiently. For seniors with digestive issues or other medical conditions, certain formulations may be better tolerated and safer than others. Personalized guidance ensures that the chosen supplement regimen maximizes benefits while minimizing risks. Monitoring and follow-up are also critical components of safe supplementation. Blood tests can confirm whether nutrient levels are improving and whether adjustments are needed over time. This is particularly important for seniors, as their nutritional needs may change with age, activity level, or evolving health conditions. A healthcare provider can track these changes and make evidence-based recommendations to optimize joint health, muscle strength, and overall mobility. Education is another benefit of consulting a professional. Seniors can gain a better understanding of how nutrition, exercise, and lifestyle choices work together to support musculoskeletal health. They can learn about safe sun exposure for natural vitamin D synthesis, dietary sources of essential nutrients, and exercises that strengthen the legs and protect the joints. This holistic knowledge empowers seniors to make informed decisions that have long-term benefits for their health and independence. Finally, consulting a healthcare professional provides peace of mind. Many seniors may feel uncertain or overwhelmed by the variety of supplements available, conflicting information online, or fear of interactions with medications. Professional guidance removes much of this uncertainty, ensuring that every step taken toward improved joint health and leg strength is safe, personalized, and effective. Through professional consultation, seniors can take a proactive, informed approach to supporting their bodies, addressing deficiencies safely, and maintaining mobility and quality of life as they age.